Hello, welcome to my frequently asked questions. Today I'm asking a commonly asked question: do I need maintenance after having facelift surgery? So in answer to this question, well, you've just had facelift surgery, you've just had the recovery from the surgery, and you look good, you look fresh. Do you need to have another treatment of any kind, or can you wait years before having another procedure? Well, in a way, you've just invested time, energy, resources in undergoing a facelift surgery, and that has given you rejuvenation, it's improved your jawline, it's lifted everything where it used to be, it's taken away centimetres of loose skin. However, there is still an ongoing aging process, and in order to get the best results, maintain things for longer, often you need to do a little further, once or so a year. So things that will happen to all of us with time: each year we have a little bit of thinning of the skin, we have a little bit of volume loss, there's some change in the skin quality like fine lines and pore size, sun damage, effects of gravity, and each year there's a little bit more loose skin. And so these changes occur slowly over like a long period. However, if you do things to maintain the results from your surgery, it will last for longer and you will have better results, and you will put off the need for having further surgery for a much longer time. And so in terms of non-surgical treatments, well, many of my patients are concerned about having non-surgical treatments because they're concerned about being unnatural. And we've all seen celebrities, famous people who looked puffy and unnatural, and this is one such patient who, well, Nicole Kidman, who just has that little bit too much volume in certain areas of her face, and it just doesn't look quite natural and quite like her. And there are all these terminologies that have been given to non-surgical treatments like sunset eyes, chipmunk cheeks, duck lips, witch chin. All of these things, well, they can largely be avoided by completing treatments subtly and conservatively. And definitely when it comes to non-surgical treatments, less is more. Good non-surgical treatments, you cannot tell a patient's had them. And of course, there are a few risks with them: scarring, damage to vision. Now, these things are very rare, but it's important to be cautious about non-surgical treatments in order to avoid these issues. So with good non-surgical treatments, people such as people can look good, they can look natural, and it can be very difficult to tell they've had treatment. And this is another photograph of Nicole Kidman where she looks fresh, her face looks thinner. Yes, there is some volume in her cheeks, but it looks more natural. It doesn't look like the previous photograph. So in terms of things, well, do I need maintenance after having facelift surgery or neck lift surgery? Well, there are certain things that I'm going to talk to you about. Things that you can do that will make a difference. Lines associated with movement, volume loss, mild amounts of loose skin, lines or changes in the skin, devices and technology that may be helpful, and my tips from doing this for like 10 years. And so in terms of non-surgical treatments and maintenance, well, this will definitely give you the best results in a long-term basis, but let's talk through each of these in turn. Now, in terms of things, well, first of all, my name's Dr. June da Silva. I'm an oculofacial plastic surgeon in London, and I only complete procedures on the face and neck, and blepharoplasty, rhinoplasty, face and neck lift surgery, and non-surgical treatments to the face are treatments I do every day for patients. This video really consults in terms of information and educational purposes, and it cannot be the same as a consultation. Well, in terms of aging, what continues every year? Well, we have some thinning of the skin, we have some natural volume loss, we have changes in the skin quality like fine lines and pore size, we have the effects of gravity ongoing, and little amount of loose skin, like millimeters of loose skin. And what can influence this? Well, certainly age. Each year there's a little progression of these things. Then there are genetic factors that can make a difference, and there are lifestyle choices also that can make a difference. So what can we do to maintain this? Well, there are things that you can do as a patient. There are things that you can take to look after your face, your physique. There are things that you can be done about lines associated with movement, volume loss, mild amounts of loose skin can be treated with radio frequency, fine lines in the skin with skin resurfacing. And then I'll talk you through some of the devices and technology that has evolved over the last few years, and then my tips. So first of all, patient measures. Well, genetic factors, what you've inherited from your parents, these things are outside your control. And some people can be hypermobile, and by that I mean you can bend your thumb all the way back towards your wrist. And if you're hypermobile, well, that's something that you've inherited from your parents, and you will tend to have more loose skin at a younger age. Other factors are early menopause, small chin, and these factors, well, you have no control over that. Factors you do have control over include sun, avoiding a lot of sun damage, using SPF 30 or above, avoiding smoking, that tends to age and wear the skin out faster. Large losses of weight, that can also give you more loose skin. Then in terms of nutrition, well, things that we know definitely can improve your health include calcium and omega-3 fatty acids. And if you've gone through the menopause, there's evidence that HRT can preserve your face for longer by restoring some of that natural hormonal balance. Other factors that have been suggested, but there is some lack of scientific research really defining those, include vitamin supplements, and many of us take vitamin supplements, including myself, but the evidence is somewhat lacking. There's more and more evidence for collagen. However, collagen tends to be animal derived, and animal products, well, there are other issues associated with them. Sun protection factor, like factor 30 or above, can be very helpful. And although there are many different like cosmeceutical and skin products, largely many of them have lack of scientific evidence. But one that does have good evidence for is retinol. And retinol can really help with fine lines, and it can increase skin turnover. And if you have particularly fine lines around the eyes, retinol can be particularly helpful in reducing those fine lines over a long period. Lifestyle, well, walking 10,000 steps a day. Strength training improves includes muscle tone and improves physique. Hydration, drinking 3 liters of water a day. Well, there's good evidence now that sleep and sleeping more than 7 hours a day is proportional to how long you can live. And if you go with a loss of sleep every night, well, that could actually shorten your life expectancy. Aerobic exercise is certainly good. However, excessive aerobic exercise can dissolve some of the natural fat in your face and can give you a more gaunt appearance. And that doesn't necessarily mean you look better. And often a face that has a bit more volume and natural fat will look more youthful. So moving on to lines with movement, well, we can see with this patient, like there's lots of lines associated with movement across the forehead, and part of that is aging of the skin and thinning of the skin. Well, Botox can very effectively reduce movement of these fine lines and result in a smoother forehead. Lines associated with movement at the corners of the eyes, well, these are often termed crow's feet, and these can be particularly well treated with Botox. And then these lines here between the eyebrows, and this area in anatomy is called the glabella, but often these lines are called number 11s, and treating this area with Botox often will soften these lines and make this much smoother. Now, if you have a really deep lines, well, often Botox will soften them, but it won't completely remove those lines. Volume loss, well, fillers, and by that I mean mostly hyaluronic acid fillers, a complex carbohydrate that exists naturally in your skin and joints. Well, it can be used to restore volume, whether it's flattening of the cheeks, volume loss, some degree of folds and shadows can really be well treated with adding small amounts of volume. Now, when you're having facelift surgery, natural fat transfer can be used, and by that I mean fat is taken or can be taken from around the belly button, and it can be concentrated and put in various areas of your face. However, in terms of maintenance, adding small amounts of volume once a year or once every couple of years, it will just maintain those changes for longer. Mild amounts of loose skin can be effectively treated with non-surgical devices such as radiofrequency. Now, with face and neck lift surgery, we can remove 2 or 3 centimeters of loose skin. However, each year you can have a gradual progression with more skin laxity. And rather than having further surgery, radiofrequency can be used to tighten the skin, delaying the need for further surgery and improving the results. And so Judy Murray in this photograph has undergone exactly this procedure with radiofrequency, and we can see the improvement in her skin. At the same time, expectations are definitely important, because if you have more than millimeters of loose skin, well, radiofrequency is just not going to make much of a difference. However, it can be particularly helpful in maintenance. So another patient of mine who has had treatment in his neck area to tighten the skin and improve the jawline in the neck, and that just shows with radiofrequency how this can be improved. Now, kind of lines in the skin, and these are sometimes called perioral lines, or in medical jargon, smoker's lines. And it doesn't mean you have to be a smoker to have had these lines. However, sometimes they can occur in smokers. And these can be treated with a form of skin resurfacing. And there are different types of skin resurfacing. One, or the gold standard, would be laser resurfacing with a CO2 laser. And my CO2 laser uses technology that tightens superficial and deep skin in 2 different layers, that stimulates collagen and tightens the skin and improves these fine lines and wrinkles. A more lighter treatment would be types of peels, which will make a difference and have a shorter recovery period, but however they won't stimulate collagen quite the same way. Often lines in this area are a bit resistant to treatment. Often you need more than one treatment to get the very best results. Another patient with kind of fine lines around the mouth, and again this patient was treated with CO2 laser, and we can see a nice improvement in the contours of her skin. Thread lifting. Well, thread lifting has been marketed very heavily over the last few years, and the main advantage of thread lifts is that it can lift the face without cutting the skin and without surgery. The downside is, well, there tends to be some recovery with terms of swelling and sometimes bruising. It may not be the best treatment if you have particularly thin skin, as you may see irregularity in the underlying skin. And the main limiting factor with thread lifts is its duration, and it tends to last for a relatively short period of time, and then it needs to be repeated. And generally thread lifting, you can say, will last for about 6 months, and then the effects gradually wear off. Now, there are other types of devices and technology that are continually evolving, and it's important to really look at each of these devices in context and really evaluate what is true from these devices, because often they're quite heavily marketed, and quite often the results are not quite as promising as they first look. This is taken from one of these devices manufacturer's website, Plexa, and it shows the before and after photograph and changes in the lower eyelid, and it says that this is taken 10 minutes after the treatment. However, looking on YouTube, this is a patient who's just undergone exactly the same treatment, and we can see this dark reaction in the skin following the treatment. So it really does have a recovery, this treatment, and sometimes the treatment is not as effective as patients would like, because it's a superficial treatment on the skin, and often more is needed in terms of the upper eyelid to give the very best results. And I've had numerous patients come and see me who've not been over enthusiastic about the results of this. So my tips in terms of maintenance, well, definitely non-surgical treatments will help maintain the results of your face and neck lift surgery. If you've undergone face and neck lift surgery, well, if you want to get the best results long term, I encourage my patients to come and see me once a year, and each year we'll look at how your face has changed over the year, and minor tweaks with different non-surgical treatments can help the results last for longer. Often you need a combination of results to get the very best treatments. And one year it might be a little bit of volume. The second year it might be a little bit of skin tightening. The third year it might be the use of regenerative medicine to improve the quality of the skin. So it depends on the changes each year. I'd be wary of some of the devices and the marketing behind that, because some of the results of these devices are more conservative than they propose. And there are potential aspects of non-surgical treatments. Often there can be some recovery, particularly with devices. Natural results are very important, and you don't want to add too much volume because that can result in some of the puffy features we saw earlier. And there are risks and scars and damage to vision. Well, these things can largely be avoided with taking precautions and good techniques, but it's important to be aware of these aspects in order to get the best care. And I would recommend seeing an expert, someone who looks after many patients in terms of non-surgical and surgical results, to get the best advice. And there's definitely a degree of artistry with these treatments, because there is no exact measurements that can be said, like if 3 millimeters is added to this area, it will look wonderful. There's often a degree of artistry that will give the best results. So in summary, well, we've talked about maintenance in terms of what does maintenance mean, what are measures that you can take as a patient to enhance the results of your facelift surgery, lines after movement and treatment with Botox, adding volume in specific areas with fillers, mild loose skin and treating that with radio frequency, lines in the skin and types of skin resurfacing to improve those fine lines, the use of technology and how that can be used to improve results, and my tips. Well, I do hope this information has been helpful for you. Thank you for watching, and if you have any other thoughts or questions, please do not hesitate to contact me either by email or my website or through social media. Thank you for watching.